Dr. VanDyke, board certified endocrinologist, back for more talk about thyroid nodules. How do we find them? What do they feel like? So some people may have just a randomly discovered thyroid nodule totally by accident. Maybe you were in a car wreck or you hit your head or something and you go to the ER and they do a CAT scan because they do that on everybody. And whoops, there's a little something something in the thyroid. And it's a thyroid nodule. Okay, so what do we need to do about that? We really want to go to an ultrasound because that is the most accurate way to measure a thyroid nodule and to define its other qualitative characteristics. And that gives us insight about how risky this nodule might look in terms of cancer. But what about feeling nodules? Do people feel them? Sometimes they do. Sometimes you might look in the mirror and be like, what is that thing right there that I see moving when I swallow? Or they might feel kind of like general pressure right here, especially if they're lying flat. Or they may have just a large goiter and they're like, what is that? It looks weird. It's like my neck is huge. And sometimes people may have other symptoms. They might have symptoms of like hoarseness in their voice or difficulty swallowing. But what I'll say is, in my clinical experience, the majority of people don't necessarily have a symptom at all. They find this nodule by accident, or their primary doctor goes, oh, maybe your nodule's a little enlarged, and they get that ultrasound and whoops, there's some nodules in there, and they never would have known otherwise. So we're going to talk more about how to understand nodule risk and what to do about it. So stay tuned for that.